My name is Jamie and I'm a nursing student, and today I'm going to be demonstrating trach suction using my general principles and safety practices and following 11 rights and 3 safety checks as necessary. I'm going to start by entering the patient's room, knocking and entering the patient's room, and introducing myself to the patient and identifying my patient with their 2 patient identifiers. I want to provide privacy, explain the procedure we are doing today and why we are doing it. I'm going to assess my patient for any allergies and for pain. Which my patient is not in any pain right now, but if they were, we would want to manage it first. And then I'm going to want to know my patient's baseline. So I would want to know their respirations, oxygen level, and lung sounds prior to the procedure. So I'm going to be performing a respiratory assessment as well. So I'll perform my hand hygiene, and I'm going to perform my respiratory assessment.
Recommend amount. Okay, so I'm going to go ahead and pull it up. The right dosage. I'm going to have 2 flushes, one to make sure that it's patent line, and one to flush the medication. All right, so I'll grab all my supplies and head back to the patient's room. I know, buddy, I know. So I'm back. I do have the medication. So at this time,
so there is some bronchi with coarse crackles, so suction is an appropriate procedure. So I'm going to want to establish a sign between me and my patient for them to let me know any signs of discomfort or distress during the procedure. My bed is at appropriate working height and position. And so I'm good to go ahead and get all my equipment set up for my patient. So I would want to make sure that my suction tubing is all set up and connected. I would want to make sure that when setting the suction settings for an infant, it would be 100 millimeters of mercury. For a child, it could be up to 125, and for adolescents and adults, it would be up to 150, but no more. So I do have it on the appropriate setting, and I would want to make sure that the tubing is working. For video purposes, I'm not turning the machine on so that way you can hear me talk. But I would want to double check the airflow on that. And then I'm going to go ahead and place a towel across, or a pad right across their chest. I want to get my work set up.
But you don't even have to do that?
No, that's
So I'm going to get my saline box out, touching only the bottom corners, not to contaminate the plastic. I'm going to lift up my saline and pour some in.
Go ahead, inject it at the appropriate amount of time. Sing your song. Spread the head one more time. Flush. Same rate as almost done, buddy. I forgot to assess the site. Nope. I need to make sure that there's no infiltration and it's not red around the site before I start injecting. Okay. Something about it.
So now that we are sterile, I'm good to get my section hose out.
So you don't have to completely stop your video. Like that point, you could be like, okay.
Make sure that the abdomen is soft or firm.
And with my non-dominant hand, I'm going to grab the wall suction and connect them. And so now my non-dominant hand is no longer sterile, so I will use it to control the airflow of the suction. And I'm going to want to test it in the saline, make sure that the external extension piece is working as well.
The digital and the dorsal arch are just some of the places that we can.
So I'm going to take my non-dominant hand and remove their oxygen for just a moment. And when I go to enter the inner cannula with the suction tube, I want to avoid hitting anything on the outside of the cannula. And I'm going to enter until I feel the resistance. And when I do, I'm not going to apply any suction when I'm entering, by the way. But when I do hit the resistance, I'm going to start my intermittent suctioning and twisting my tube as it comes up. And I'm going to want to suction only between 10 to 15 seconds to prevent hypoxia.
Pick up there, pick up there, pick up there.
And in between suction, you want to hyperoxygenate. And you want to wait 30 to 60 seconds between suctions. And you can only do 3 passes in a go. So after 3 attempts, we can no longer proceed. So I'll go ahead and move the oxygen now that we have passed our time lapse.
Hub again.
Okay.
Medication.
I'm gonna go ahead.
This one does not have a rate. It needs to be injected.
I'm
I like
gonna
to
look at
go
that,
slow.
return him back to mom, so he can calm down. I'm gonna perform hand touching.
Another third one.
Now, at this point, I'm going to do my 11 rods of medication administration.
How you
my
feeling?
med checks during the
Looks
last
like there's
one
no
at
liquids
bedside.
or
I'm gonna
anything
assess
like
the name and date of birth again.
We'll
Finish this one.
oxygenate
Same
again.
rate as the medication agrees.
And as a, we'll do this as appropriate. So we will do one more pass.
Gloves, I'm gonna perform
Time has passed, or 30 to 60 seconds.
adverse reactions on this
Alright.
medication.
See, that wasn't too bad,
And
was it?
then I'm going to.
So at this time, I would go ahead and clean up all my space and make sure that there is no needles or any medications left behind.
Tell you about the
So that
IV
this one
site.
could
So
get
this
into.
one is in the basilic, that's a good one,
And,
it's also, in the dorsal arch to keep it away from them.
I would
so
come
they're
back
not
and
pulling
probably
that.
like 20.
So now that we've done our 3
check on
passes, we
top
can
so
no
that
longer
there's no adverse reactions at that time.
suction.
For pain
So I'll put the oxygen back on,
Alright,
and
so
I'm good
see
to
you
go
next
ahead
time. Okay,
and
bud.
clear
You
up
did
my
great today.
area and dispose
Alright, hand hygiene.
appropriately.
Okay,
And get out there.
so I'm gonna uncap.
We'll
This
see.
looks great.
Once I have cleaned up my area appropriately,
It's not as bad as
I would want to reassess my patient's pain and respiratory assessment again to make sure that the suctioning procedure we just performed was successful.
These are the ones I purchased
So
this year.
I'm going to go ahead, let me move this chuck here real quick.
I don't have them this year either, so. I got them last year.
Seems to be working good.
But you will when you start
So
now.
I'm gonna clean it again and attach my bed syringe.
I know that Becky would be like, I need kind of full.
I'm gonna
What did you want
slowly
right now?
push the medication, assessing the IV socket and make sure.
Do you have your stethoscope or do you want?
Yeah.
I do.
Okay, so it has cleared up from prior to the suctioning.
I'm just here.
Still some crackles, but it has improved. So I will want to make sure that my patient is in a comfortable position. They're still not experiencing any pain, and they tolerated the procedure well.
Well, it's over.
So once they're comfortable and have their call light, I'll provide them privacy for my hand hygiene, and I'm going to exit the room to report in the corner.